Children's Hospital. Together they form the International Birthmarks Institute. Thank you so much for joining us today. I want to introduce each of you to our audience. Dr. Ana Duarte, she is a pediatric dermatologist and the director of the Institute. Dr. Ricardo Restrepo is a pediatric interventional radiologist, and Dr. Chad Perlin is a plastic surgeon here of pediatrics, and all of you form very important roles and have important roles in this institute. Let's start off with Dr. Duarte. Explain to us, what is the International Birthmarks Institute? How did it come about?
Well, as a leading children's hospital, the International Birthmarks Institute is Nicklaus Children's Center of Excellence for the treatment of all birthmarks, with a special focus on vascular birthmarks. So basically, as you mentioned, it's a comprehensive group of pediatric subspecialists represented here, interventional radiology, plastic surgery, dermatology, but it really encompasses the entire hospital. And so we coordinate care. We speak almost daily about patients, but we meet every month and we talk about cases and we go over their dermatological findings from a plastic surgical perspective, from a radiological perspective, pathology, hematology, genetics. We look at the whole patient and then we put together a plan of care. And by coordinating our care and enhancing our communication, I feel that we definitely improve our patients' outcomes.
It's so wonderful that the patients have that opportunity to have all three of you working together for the best of their care. Dr. Perlin, tell me, as your position is plastic surgeon, what is the role that you play in this team?
Sure. So, like you said before, by the way, it's so nice for the families because it's like one-stop shopping for them, and they're able to get the expertise from all of us in this one visit and leave with a comprehensive plan. My role as a surgeon is really twofold. The first thing I look to see is this something that can or needs to be removed? And some of these problems do require surgery, but oftentimes the most important decision the surgeon can make is not to operate. And that's where having the expertise of a team comes in, that we don't just rush to do surgery. We really analyze the situation and say, is this something that requires an operation? Or can we step back and be more conservative and treat it with medicine first, or some of the radiologic sclerotherapy or embolization procedures? When the decision is made that surgery is actually necessary, we then help coordinate that. And it's our job to remove the birthmark, but to preserve form and function. And that's what we love to say in plastic surgery. We want to do a surgery that yet is going to not remove any critical parts and be able to reconstruct everything and still keep everything working the way it should be. And that's really our job and our role in the team to help with that.
And Dr. Restrepo, you are on the side of the radiology as an interventional radiologist. What is your perspective when it comes to the different conditions and the different treatments that are available to the patients from that perspective?
Well, as a radiologist, I play two roles. It could be a diagnostic or an interventional radiologist. Diagnostic, I look at the usually ultrasound or an MRI. They send me a lesion that could be a birthmark or something related, or maybe something that is mimicking it. And when I do the ultrasound or the MRI, as I said before, we can narrow it down and we can say with certainty, yes, this is one and needs treatment. Sometimes we get tumors that can mimic those conditions, and you can say, you know what, this patient probably needs a biopsy or needs to be taken out, and because it is definitely not a birthmark. So that's part of what I do on the diagnostic side. On the interventional side, it's like the treatment side, and Dr. Perlin briefly mentioned it. Sometimes he sees the patients first, or Dr. Duarte, and they said, you know what, this is mainly vascular malformation. So let's treat it. I could treat some of them, with sclerotherapy or embolization, just injecting medications just to burn them. And that's the treatment part of an interventional radiology.
And Dr. Duarte, I think it's fair to say you're perhaps the first line of defense, because you perhaps would see it first, see the patient. For parents out there who are watching us and wonder, oh my goodness, my child has a birthmark, could this be something more serious than just a simple birthmark? What is your advice to them, and how do you go about diagnosing?
Well, I think it's really important that any birthmark that your child has, that you bring it to the attention of the pediatrician, and that's the first line. And then usually the pediatrician will send the patient over to me as a pediatric dermatologist to further evaluate. So I think that most of the lesions, fortunately, are benign and very common, so the parents don't really have to worry too much. as long as they come in for an evaluation, and I usually reassure them. Now, there's a lot of lesions that can be treated and treated safely, especially when they are around the eye or the nose or the mouth or the lower third of the face. Sometimes they'll involve the airway. And in those cases, we have great medical treatment. Propranolol for the last decade has been the treatment that we're using to shrink hemangiomas, the most common tumor in infancy. That's one of the birthmarks that we see most commonly. And we have great treatment for that. And then we'll often coordinate care with plastic surgery and also with radiology and with ophthalmology and cardiology. So you need a multidisciplinary group, which we have, which is what makes it so nice. And oftentimes patients can come in, those that do need treatment, and see several subspecialists on the same day to get their plan of care going. So I think the important thing is to have the lesions evaluated early and either have the reassurance or institute treatment, because early is key with infantile hemangiomas. And we also see some port wine stains. These are little capillary malformations that, again, early treatment is better. We can get the laser going, which oftentimes can be done in the office. So it's important to come in and just be evaluated.
That's great. And when you speak about early, how early? What ages? At any age?
With port wine stains, within the first week of life, we can start laser treatment, and it's more effective. That's what the literature has shown. And with hemangiomas, we want to see them within the first month of life, because we want to catch them before they start to proliferate or grow.
That's wonderful. From the perspective, once again, of a plastic surgeon in the reconstruction, there's a lot of hope for kids who are found to have.
Oh, absolutely. You know, there's really two facets of my job. One of them is treating surgically the birthmark or the vascular anomaly, and the other is secondary reconstruction. And the two are very different. So, like Dr. Duarte was saying, ideally we like to, when we can, intervene early when the lesions are small, and when, if surgery is needed, we can control where the surgery is going to be and how to perform it to remove the lesion. But there's also a whole another part. On children who have had significant birthmarks, we see a lot of children from Cuba, for example, where they may not have been treated early. And instead of having a lesion which should have been no bigger than a dime, it's suddenly the size of a tangerine. Maybe it's on the tip of the nose, like that. So not only is part of my practice involved in the early removal of these lesions, but also, like you say, in the reconstruction. And to be able to, as there's a great quote in plastic surgery, which is to give back what nature hath taken away. Is such a wonderful feeling for us in plastic surgery, because you make the child whole again, and that is something so special, not only for the child but for their whole family as well.
In some of the cases, I'm just curious, and perhaps some of the parents watching us are as well, do you ever get to go full circle, all of you, to see the patients? Because I know they go in stages. Are you able, as the radiologist, even to be able to see a full circle?
We do actually a meeting every month, a multidisciplinary meeting. Everybody comes, all three of us, and they come. We have hematology, oncology, by the way. We have general surgery. We have pathology, very important, and geneticists, and all of us go, and even me as a radiologist, go and see the patient, examine the patients, and we discuss it in front of the parents and the patients.
You mentioned genetics. Is that a part of it as well? Can it be?
Sure. There are several different conditions that are have a genetic issue to them. Some of those are more what we call multifactorial or systemic, where it's in different parts of the body. So, again, that's why I think getting good information early on from your pediatrician, from pediatric dermatologists or plastic surgeons, or learning to use the internet to find the right sources of information. Things like the Vascular Birthmarks Foundation, places where we know high quality information is being given, is key, so that families can help understand the nature of their condition and what other things may or may not be associated with it.
In the experience that you've had in dealing with patients that are going through this and parents, are the parents, do you find, are they fearful at first that maybe there isn't a solution, that you can calm their fears? I mean, I have to think, to be able to see just automatically that you have an entire team working on it has to give them peace of mind.
Absolutely, absolutely, and they we try to reassure them. I mean, they have a lot of birthmarks are not only cosmetics; they can have also other problems, among them like bullying or personality problems, because they can be very disfiguring, and that's where dermatology and plastic surgeon play a very important role as well. But there are other issues, not only the cosmetic issues, and we try to reassure them.
Absolutely. I think you mentioned it briefly, but once again, when you talk about secondary conditions that a birthmark actually can lead to, What
Right.
are some of them, the more
So
common ones?
So some of the birthmarks, for instance, a port wine stain, if it affects the upper third of your face or a patient's face, it can be associated with glaucoma and even seizures. So it's called the Sturge-Weber syndrome. So those patients are evaluated by ophthalmology and neurology. So again, team effort.
Excellent.
And Klippel-Trenaunay-Weber is another syndrome, which you have a port wine on an extremity, and a lot of times it's just on its own by itself, but you do the workup to see, is that person going to have an overgrowth? So you involve orthopedics, which is also part of our team. So really every pediatric specialty at one time or another comes into play for these patients.
That has to be so wonderful for the parents to know that just going, you think about it as a parent, you get a diagnosis, let's say from a pediatrician who suspects that there could be something wrong. It must feel like, where do I go, where do I turn? And the thought that you can go somewhere and know that every single doctor will be watching it and not jumping at any sort of conclusion. You're truly going to investigate, work together, figure out the best course of action or treatment for the patient and have the best results. Any advice you have for parents other than what you've already told us? We have a great opportunity of having all of you here, so I want to give them information.
I think the best advice that I can give for families who are watching is to find a center of excellence. It doesn't have to be here in Miami. It can be anywhere in a community that's near you. But to find a center of excellence where the physicians truly understand first the diagnosis. And I often laugh with families that it's like when you say, oh, get me a Coke, right? You really want a Sprite, but we just use the word. Or I also use the example of being in a citrus stand and how the tangerine and key lime and lemon, they're all citrus, but each one is very different. And that happens in this field. We all the time see children come in and the paper says hemangioma. And it's absolutely not a hemangioma. No one would confuse a grapefruit with an orange, but yet that's what happens in this field. So the first thing is find a center of excellence where the physicians truly understand the nomenclature. As silly as it sounds, knowing the right words as to what to call the problems is key because exactly makes all the difference. And then from there, having the different disciplines of expertise, not only as we've talked about surgical or radiology or dermatology, but things like hematology and oncology to use some of the newer drugs which were once experimental but now are becoming mainstream in centers of excellence. So the more parents can bring their children to centers where there is a focused team approach,
And
the better the care will be.
The
And
technology must make a huge
Absolutely,
difference
yeah.
as well. That you
Yeah.
have that at your disposal to
No,
be able to
and
help them.
you say things like technology. There's so much of this that we're now learning as to why children's hospitals matter. For example, fast imaging. So we try not to give anesthesia as much as possible. So if you're at a pediatric hospital where they have very fast machines that give very low radiation, it's the perfect combination. Go to an adult hospital, maybe they're different machine, different doses of radiation. So you want really everything to be tailored for the child. And that's why...
So there's the least harm to the child while helping them
correct, exactly.
the way necessary.
You know, when I do my procedures, because that's a very good point, Chad, when I do my procedures, I use ultrasound mainly. That, is actually very available. We can do it even bedside and doesn't have any radiation. And I can guide my needle. I hold the probe right here with my left hand and I follow the tip of the needle, and then I'm very precise when I inject, or treat the patient, or even if I have to do a biopsy, because sometimes we're not sure and we have to do a biopsy. That would be another advice I have to the parents, because you may think it's a vascular or a birthmark, and it might be a tumor that mimics the birthmark that could be malignant. It's unusual, but it could happen, and we can treat it on time. There are certain mimickers that you think it's a birthmark and they are not.
So you shouldn't take any chances.
No chances.
Absolutely.
And if it's a birthmark, we'll treat the birthmark. If not, if it's a tumor, we'll deal with it. Oncology and hematology are in the team as well.
Well, thank you so much. The message is clear. As quickly as possible, if you think there may be something, early detection is key, and that you really should find somewhere to go where you can get the help that you need in a multidisciplinary way, which we can all see what the benefit is in that. The great news is that for any parents out there who are watching us and you want more information, there's plenty more for you. On Saturday, May 5th, Cinco de Mayo, that's easy to remember. No margaritas, but there is going to be an incredible amount of information for you. A very special event. Tell us about that.
So it's Nicklaus Children's Hospital's first vascular birthmarks meeting, and we're really excited to be able to have a patient and family-focused meeting. So the three of us will be there along with others in our team to give talks,
and talk about basic nomenclature, like we talked about. What are these lesions? Pathology, genetics. We're going to speak about diagnosis and treatment. We're going to talk about the psychological effects of having a birthmark, bullying, the effects of bullying. So it's going to be a lot of information in a very family, patient-friendly way. We're going to have some industry leaders here with laser technology, and also support from industry in terms of medications. And they'll be here to answer questions as well. And we're going to have a great lunch. And then in the afternoon, we're going to have private consultations. So at no cost, we'll be able to, you'll be able to have an evaluation by the three of us, dermatology, radiology, and plastic surgery. And we can give you, the patients, our opinion.
That's wonderful. So parents can come out here with their children. If they have any sort of questions when it comes to these birthmarks and you want any more information, just come here and you actually get the opportunity to have these doctors here for you. That's wonderful. Again, Cinco de Mayo, May 5th, on Saturday here at Nicklaus Children's. If you want more information, all you have to do is log on to nicklauschildrens.org/events, and all of the information will be there for you on letting you know how to register and whatever other information, where to go when you get here on campus. All of that information will be there for you. Thank you, doctors, so much for joining me. A wealth of information.
Great, thank you.
Thank you very much. We hope you'll join us
you.
again the next time on Talking Kids Health. I'm Beatrice Canals. Have a great day.
Thank you.
Thank you so much.
Oh, you're
doctor.
welcome.
It's wonderful. Thank you.